Pacific, natural disasters happen every year. But amidst the efforts to repair buildings and roads and provide people with urgent food, water and shelter, another important area is often overlooked during disaster responses: sexual and reproductive health care for women.
We focus a lot on their physical harm, their needs, their food and water, but in terms of health, it's just physical harm. There's not much done in regards to their sexual and reproductive health.
Women's needs for reproductive health care don't stop during crisis. In fact, during disasters, there can be an increase in maternal and newborn deaths, sexual violence and its subsequent trauma, the spread of HIV and other sexually transmitted infections, unwanted pregnancies and unsafe abortions. Neglecting sexual and reproductive health care during disasters can have serious consequences for women and girls.
This is the very first pilot of a nationally contextualised sexual reproductive health in emergencies simulation exercise.
To help Pacific women during these times of crisis, the humanitarian team from the International Planned Parenthood Federation, or IPPF, works through its member associations to empower Pacific Island countries to respond effectively and to meet reproductive health needs during and after disasters. To help its member association navigate the challenges in delivering its services during and after disasters, the IPPF Humanitarian team convened a simulation exercise or SIMEX training workshop in November 2021 that brought together many agencies involved in disaster response.
So another way of looking at this...
By conducting the SIMEX training and bringing in all of these stakeholders that are involved, we are able to orient all of these organizations into the same direction so that we ensure that everyone is providing the same standard of services to all of the populations in need.
Who do we need to consult? Do we need to consult maybe?
Many of the participants recognize the urgent need for the training.
When it comes to disasters, everybody knows their role. But when it comes to disasters, the coordination is disarray.
What we're going to do now is how do we mitigate the risk of that happening?
The training simulated some of the experiences the member association might face during an actual crisis. The training focused on problem-solving activities that reflected real emergency issues within the Fiji context.
We are just looking at where we can, provide easy transportation. But what if it's happening somewhere like the Lau group that's very far?
The key topics the training highlighted were coordination between the various disaster response organizations, preparedness planning, and response in terms of service delivery during a crisis.
She has completely cannot talk.
Through discussions and active simulation exercises, participants shared common experiences and through these developed more capacity to coordinate more effectively and respond more efficiently during crisis.
Having that capacity would not only be just great for the team, but it would also mean that we as a service provider do a better job in SRHIE, and that is essential because that's our mandate, that's our core, that's why we exist.
It's a big learning from my end, and it's also quite a contribution on how well we can go and probably just build up to another standard, the level of our work and how we can strengthen our network and partners.
Sometimes women, they don't want to report cases because of a lot of things that are happening at home.
An important part of the training was to highlight the importance of communication between the various partners during a disaster response.
With our past experiences in humanitarian response, a key thing that we lacked was communication with other stakeholders and CSOs. We weren't providing the services needed to the community. We were just rushing in, trying to help, but we weren't really helping. We were getting in the way of actual help.
The importance of having consistent policies and operational manuals was also highlighted in the training.
One of the things that trigger into my mind is the standardize of the manuals, how to, looking at the designing and developing of manuals under SRH and mainstreaming SRH into other existing program of the organizations.
Conducting face-to-face training using simulation exercises helped ensure the member association and its partners will be better equipped to respond appropriately during real-life emergency situations in Fiji.
So by planning and communicating beforehand, we stand to narrow down the services that the communities will need and provide them at the times that they do need them.
And so having seen them in the last 2 days as part of the simulation was a good indication of how important coordination is. It's about how do we strengthen our own partnerships within to be able to feed better when it comes to humanitarian responses.
Through its network of member associations in the Pacific, the IPPF Humanitarian Team is one of the few organizations that is there before, during and after a crisis. Through their responses, they help protect the lives of many Pacific women and girls.